being here today at the Mind Myself event. Today is Aging Gracefully from the Inside Out. Listen to your skin's story. And I'd love to begin just with a few breaths together, just to ground ourselves. Feel your feet on the ground. If you're sitting, feel your seat on the chair. If you're standing and moving, feel your feet solidly on the ground. And let's just take 3 breaths together in your own time, in your own pace, and I will bring us back. You can keep your eyes open or closed. Let's just take 3 deep breaths. Hold it at the top. And final breath together. And release. Thank you. That's great. I'm Esther. I'm the founder and CEO of Mind Myself. And it is my pleasure to bring these events to you. In the midst of everything you could be doing, you are choosing to spend some time with us, and we are so grateful. There's so much to be learned. There's so much to be shared. There's so much heart to be connected with. And the vision of Mind Myself is cultivating unity in times of divisiveness. It's also giving you more choice, and it's helping you feel seen, heard, and supported on your journey to health. And I thank my team. Bill is my constant support. He's my partner in life and in everything. And Wendy, thank you for being here, especially at the last minute like this. And in the chat, for those of you who are watching this live and with us now, please put in the chat where you're from and what questions you'd like answered about skin and aging, or if there's something else that occurs to you, who knows? And I want to also honor Dr. Jenny, who was to be with us, but something else came up last night and she is unable to be with us today. So sending love to her and her circumstance as it is. And I always do a land acknowledgement, and I've shifted it up today. So let's just do this. I respectfully acknowledge the traditional land stewards and their ancestors of the Katzie, Coquitlam, Kwantlen, and Kakite First Nations on whose lands I live, work, and play, and whose waters I drink. This land is also known as Surrey, BC, Canada. And a disclaimer, because we are talking about health, I just want to say all the information and advice from Mind Myself and the practitioners is for general education purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information here and on the Mind Myself website should not be used to self-diagnose or self-treat medical conditions. We always recommend that you consult with a doctor or other qualified healthcare practitioner for individualized medical advice on specific medical issues. The views and values of each practitioner do not necessarily reflect the views and values of Mind Myself. I came across this quote in a magazine from the Choices markets recently, and I just loved it. So I'm going to share it with you today. The skin is the body's largest organ and the meeting place between our external and internal worlds. And that's by Michelle Shafro. And she's a cook, Michelle Shafro, cook, PhD, and DNM. And your skin is a testament to your journey, resilience, and strength. There are many things that are a testament to that, but today we're talking about the skin, which is that. And we have 2 amazing practitioners with us today, and I'd like to welcome them both here and express my heartfelt gratitude for sharing your time, your wisdom, and your hearts with all of us. So, Dr. Vicky, can you introduce yourself and tell us a little bit about your incredible practice and your passion in the health space?
Well, I am retired wellness doctor, OBGYN, of over 35 years. I also was a medical director for a Medi Skin Spa for 12 years. So I brought a health and wellness aspect to the world of cosmetics, if you will, and cosmetology, and what many people think of an aesthetic spa as being more about Botox and injectables. But I also did regenerative medicine and I did energy medicine. So I did wellness from a multitude of directions, and feel that bridging both the health part and then the cosmetic part of skin just gave me a unique perspective on how I managed my patients medically, because skin, as you mentioned, Esther, is our largest organ and it reflects everything we do, everything we eat, every environment that we're in. It's a direct reflection of what we have been doing. So it reflects our aging, it reflects our past, and hopefully we can help it stay healthy as we go forward and not defy our age.
Fantastic.
Mhm.
Thank you, Dr. Vicky. Dr. Simone, can you tell us a little bit about yourself and how you're coming to us?
Absolutely. So I am Dr. Simone. I am a naturopathic doctor. I've been practicing for several years now, and I've always had a really keen interest in dermatology and skin. Growing up myself, I struggled so much with hormonal acne as a teenager, and I always thought one day I would really want to help kind of in the world of skin. So here I am. I've kind of niched in that direction in my naturopathic practice. And along with that, of course, when you're treating skin, as Vicky had mentioned, it really is a window to what's going on inside. And as a holistic practitioner, my goal is to absolutely treat from the inside out. We can do everything topical, but if we aren't finding what the imbalances are inside, whether that's hormonal, whether that's nutrient depletion, we need to focus inward as well to get the best result on our skin. So yeah, I take a holistic approach, and I also see within my practice, it's mostly female health. I end up working with a variety of conditions, particularly more hormonally focused.
Mhm.
Fantastic. Wow, we have eminently qualified people to ask our questions of today and to have a rousing discussion. Let's start off, and really we're just continuing the discussion. How would you define what is skin care? What does that actually mean? Dr. Simone, why don't you start us off?
Mhm. Sure. So skincare, I mean, it's of course going to be a little bit different to everyone. The kind of classic thing you would think of is skincare is what we do to our skin day to day from a topical sense. But how I see skincare, again, being more holistic in my approach to skin, is everything that we're putting on our skin, everything that we are ingesting, what we're drinking, what environmental exposures that we've had. And really, when it comes to skincare, it is how can we best support our bodies? Everyone's got a different set of genetics, a different skin type, and more prone to various skin concerns. So it is how can we as individuals give our bodies the best chance of having the healthiest skin as the skin that we're in. So I'm a big proponent of healthy skin, not perfect skin. We can't stop aging. Aging is a part of life. It is how can we age our skin in the most healthy way possible.
Thank you. Dr. Vicky, what is skincare?
Well, skincare, everybody thinks is superficial. And,
Mhm.
you know, as Dr. Simone just very eloquently said, it's not just what our exposure from the outside, it's what is from the inside. So I want to give you a visual for a minute. I want you to think of somebody, a contractor building an apartment building where many people are going to be living in apartments. Okay. Think of that as the many organs in your body. I want you to think of the construction process as first you have the foundation. And that foundation is our hormonal balance. That's the way I teach. But that balance, whatever your foundation is, has to be solid, or as you build up, you're going to have cracks in the walls. You're going to have windows that don't close well. You're going to have plumbing that breaks. You're going to have issues inside that body, inside that apartment building before you've ever finished it, because the foundation is not solid. Okay. Then I want you to think of you put in the plumbing, and that's your circulation. You build the walls. That's all your tissues and organs in your body and on the inside. But then what is on the outside? You build the outside out of whatever material it is, but that outside has to keep safe what is on the inside. And so as our skin will tell you, it is supported by so much from inside: our circulation, our nervous system, the collagen, the very collagen that gives us our cheekbones supports it. There are just many, many factors. But again, if that foundation is not solid, then that apartment building is going to show its age sooner, with cracks on the outside and just problems. So, and you might have that apartment building torn down and replaced, but that's premature. So it's probably not the best example I can give, but all of us have seen construction underway. And I just want people to understand that it's a process. It's a process that you have to manage it as you go through life. And there are many factors that go into it, but it is your largest organ, is what we show to the world. And we want to be very happy with and very proud of how we present ourselves to the world.
And here's the topic. How does aging, I think it follows with your metaphor there, Dr. Vicky. How does aging affect or impact our skin? Why don't you carry on with that, Dr. Vicky?
Well, and again, circulation is one of the ones that I just talked about. So how can circulation go awry? Well, you can have it go awry with a condition called rosacea. And rosacea, by definition, is increased blood supply per square inch to your face. And so think of bending down and coming up, and your face would be brilliant red if you have rosacea. That isn't your fault. That's just what it is. Wearing sunglasses out in sun, a rosacea person would have raccoon eyes. They would have more redness and white reflecting where their sunglass was preventing those, rays from hitting their skin. So that's one example of circulation. But, if you have a nerve condition, like let's say you have a Bell's palsy and you have paralysis, even if it's temporary, to a part of your skin, that lack of movement is going to have an impact on all aspects and layers of your skin on one side versus the other. And that reflection of skin health can look different for several weeks to almost several months afterwards. The actual support system, the collagen underneath, we lose collagen as we mature. We kind of rearrange it. It gets damaged. We don't have good means of replacing it unless we take collagen, and the right collagen. But again, that's your cheekbone. That's your support for. And then going out in the sun, do we protect it with sunscreen from UVA, UVB? And then the actual skin itself, is there hormone imbalance, that foundation that might be giving a hormonal acne, or that you're getting premature wrinkling because of dehydration in skin from hormone imbalance, or polycystic ovary causing a different kind of acne. So there are many aspects to the medical approach to skin and skin health. It's not just superficial, it is from within.
Thank you, Dr. Vicky. Dr. Simone, from a naturopathic perspective.
Yes. And could you repeat what your
Sure.
initial question was?
Yeah, for sure. How does aging affect our skin? I know Dr. Vicky just gave us such a complete
No, it's great. I love
perspective.
it because we can build on all of these things. That's kind of the point of this. We have this big skin conversation.
Yes.
But I mean, in terms of aging, if we're looking at it kind of from a definition of what is happening when our skin is aging, really it's aging skin reflects basically an accumulation of damage to the DNA in our skin. That can happen internally and from environmental or external sources. So what's happening when we age is, yes, we're losing collagen and elastin, but we're also having a shift in our fat cells, which make up a large part of our skin and our skin barrier, and also our muscle, and even our bone structure will change over time. So all of this, along with, as Vicky mentioned, environmental exposures to things like UVA, UVB rays, are going to contribute to less laxity in the skin. There's going to be less cell turnover as we age, meaning there's more room for dead skin cells to hang around. That's why the skin ends up looking a little more dull. The other part of this is the ability to retain moisture over time will decrease with a decrease in all these other tissues that I mentioned. So something, for example, like hyaluronic acid is what helps our skin retain moisture. And we know that our skin is over 60% made of water. So when we age, I mean, even after age 20, we've got less hyaluronic acid every single year to kind of hold those water molecules in the skin. So all of these things contribute to age over time, and a large part of it is genetic, but just because you have maybe a predisposition to your skin aging one way doesn't mean we can't support the skin to age in the best way possible for you. So that'll be kind of my point on aging.
Fantastic. Well, and as the foundation of it, what is natural in the aging process for our skin and what is not? And we've had a couple of questions in the chat
Yeah.
about collagen. So changes in collagen and elastin production, cellular
Yes.
turnover, moisture retention, premature aging. What's natural and what isn't? Maybe Dr. Simone, you could start us off there.
Sure, I can start. So, absolutely gaining fine lines and wrinkles, and to some degree, getting that laxity. All of that is a very natural process, and I mean, uh, there's a lot of, I think historically there's been a lot of shame in aging, and we're trying to keep our skin perfect and youthful when really, we have to embrace the skin we're in and the skin that we're blessed with. And as you said, it's kind of your skin is a reflection of your life's journey. But that being said, we can absolutely speed up that process to make it something that's, amplified. We can definitely amplify the aging of our skin. So, to a degree, of course, our skin is going to be exposed to the sun. So over time, with that laxity and dullness, all of that is to be expected. But I suppose what would be unnatural or sped up aging would be signs of sun damage, extreme sunspots, or dysregulated something called melanin production. So melanin, it creates the color in our hair, our freckles, our skin, our eyes, and that can get dysregulated over time and lead to things that you see show up when you're aging, like liver spots, sunspots, increased moles and freckles, things like melasma. These are processes where there's actually been a dysregulation of some sort at the level of what's called the melanocyte, so the cell creating melanin. And there is kind of a term going around that's gained a lot of popularity called inflammaging. So in my mind, there's two parts to this answer. So there's regular amount of aging, which is normal. And then we can speed that up by certain environmental or internal factors that contribute to more inflammation circulating in the body. And really, that's what we want to try to prevent when we're looking at quote unquote successful aging, is not speeding up some of these aging processes by doing certain things in our lifestyle or exposing ourselves to things that are going to increase our level of inflammation, because ultimately that will speed up the aging process. And I can explain, depending on our questions down the line, I can explain what that actually means, but I don't want to take up too much time with that if it's
Fabulous. Thank you, Dr. Simone. Dr. Vicky, aging, what is natural and what is not natural about aging and skin?
Well, one of the premises of women's health as an OBGYN is following women's hormonal journey from puberty through menopause and then beyond menopause. And it is usually women who are most pressured by society, who pressure themselves, therefore, to have the perfect skin. How many times a day are we seeing advertisements for, whether it's written or pictorial or in digital media, about the right skincare cream to prevent wrinkles and to moisturize, and so we're constantly reminded, shall we say. But what gets lost is our natural journey from puberty through menopause and beyond, and some of the hormonal imbalances that are genetic, like polycystic ovary, which can be more male hormone than female, and how that progression over a normal menstrual career can be an accelerated process of almost constant adolescence, where the acne component of seems to be ever recurring, and you can't get rid of it. Rosacea with hormone imbalance is like 1 + 1 = 10 in a skin reaction, because think of extra heat to a face with extra blood flow, changing the actual ability to keep the skin hydrated, number one. But number two, you have different bacterial growth with an increase in skin temperature, which just feeds the whole hormonal acne with a rosacea. Couple that with polycystic ovary, and that can lead to an abscess, and even an abscess in glands on the face, which can be one site, it can be other body sites where there is skin to skin contact, like underarm or under bra or along a neckline or a panty line. So those hormonal imbalances are going to naturally happen. Think of a bell curve, adolescence, think of 20s to 30s, you're at the peak. Think of then in your 40s, you come down. Now there's variation individually in there, but all of those hormonal changes are going to have an impact on every organ in your body, but your skin is going to be the reflection of that. And so it is something that even a woman who gets pregnant, who goes from her normal levels of hormone to 100th percentile, if not more, but then after she delivers, boom, all the way down to almost menopausal levels. And the skin is a reflection of that level of hormone change. And many times that drastic level of hormone change can change hydration and circulation. Think of a hot flash in a postpartum mom, which they happen just like in a menopausal mom or grandmother, and how that will let fluid out with that redness, that vasodilation. And then when it comes back down, it's back to, quote, normal balance, but you've just now lost a bunch of fluid via that vasoconstriction. So, or vasodilation and then constriction. So there are many aspects of how simply going through the natural stages of women's progression through our hormones and our hormonal life can be a tremendous influence on how our skin reflects those hormone changes.
Excellent. And we'll get to some of these other things like in more depth, rosacea and sunscreen and those kinds of things. But let's carry on with the next thing. So skin care as we age, how is it different from, say, somebody in their 20s to somebody in their 50s or beyond? What are some of the recommendations? Dr. Simone, why don't you start us off?
For sure. So, I mean, leading on to or adding on to what Vicky was saying with the hormones. So, especially for women. For men, it's a little bit different because their hormonal clock it's not quite the same. Their hormones are quite steady for most of their life, whereas females, we know we go through so many different changes. We've got puberty into, the years of pregnancy, postpartum, perimenopause, menopause, and at each one of these stages, skincare is going to potentially look completely different. And it's, again, thanks to our hormones. So essentially estrogen is what helps our skin produce collagen, elastin, hold more moisture in the skin. Progesterone, on the other hand, and we can have kind of various imbalances between the two based on our genetics, and fluctuations in periods of life. But progesterone is going to stimulate slightly more oil production. And so when we have either of these out of balance, then we're going to see that show up on the skin. I kind of think of the skin as the canary in the coal mine. So if something is not in homeostasis inside, we want to be, very respectful of what's happening on the skin, because it is kind of a window to the inside. So going back to the skincare piece without going on a tangent, in younger years, we want to, depending on kind of the main things that individuals are presenting with, the most common ones I see would be dealing with oilier skin, acne, perioral dermatitis. And then as we age, all of a sudden we're starting to deal with a little more hyperpigmentation. So as we continually expose ourselves to sun and the environment, and over time, we are dealing with the natural process of aging. It's going to be more important to focus on cellular turnover. So when we're young and we're under 20 or even under 30, our cellular turnover is pretty good, meaning our skin's pretty good at creating new skin cells, sloughing those off, and generating more. We've got a lot of good collagen production. After age 30, this declines significantly. So that's where the focus is going to shift from maybe just focusing on skincare in terms of, okay, what is the hormonal imbalance or the skin condition at hand, to actually trying to replenish some of the collagen we've lost, increase cellular turnover so that we're getting fresh skin cells a little bit faster than we would naturally. And then also going into kind of the perimenopause, menopause side of things, that's when I see a lot of underlying skin conditions that maybe were kept at bay before really getting exacerbated, because our hormones really help to regulate inflammation. They help to regulate histamine. And also we're exposed over time to so many environmental pollutants, even within our food system. Even if you ate the most perfect diet on earth, we're still exposed to a ton of chemicals day to day in our environment. It's just kind of the way of life now. And so we really want to emphasize the internal piece of nutrition, antioxidants, everything we can do to slow down that inflammaging process and make sure that we're not kind of speeding that up. But short story long, it's going to shift over time to focusing more on replenishing and also preventing more what we call oxidative damage or stress to the skin by fueling ourselves with lots of antioxidants and using things topically that will also support the skin from the environmental factors we've been exposed to through life, and are also kind of prone to because of our hormonal shifts. Yeah.
Thank you, Dr. Simone. And that term inflammaging, I know it's a buzzword right now, but there's a lot of merit to that. So
There is,
Dr.
yeah.
Vicky, how does skincare differ as we age? What kinds of things can we do differently in addition to what Dr. Simone has said?
Well, and I echo everything Dr. Simone said. What I would tend to see both cosmetically as well as medically is that in the adolescent teen, even though they're going up, it's many times a very rocky up and down road as they angle their way up to their 20s, with more general regular hormone production, is that they actually have such an imbalance in whether they are making more testosterone versus more female hormone, that many times it isn't just a perioral acne that they will have. They will actually have more of the cystic acne because of that testosterone influence. And they have a higher sebum production. So they're making more oils on their face. There is a much higher tendency before they understand the emphasis of skin care to not be constantly touching their face. And so the transfer of bacteria to their face when there's already more oil there can actually be problematic. And therefore, many times I would be working with astringents and things that were ways to actually have drying, if you will, of areas that had more oil production. So working with some, but not a lot of a vitamin A retinoic acid type of drying, but more that you were working with glycolics and you were working with trying to decrease oil and sebum production. That changes in your 20s and 30s. And we understand then the importance of balance to our skincare, that you have a cleanser and that you need to moisturize and you need to hydrate. And you actually will many times have 2 or 3 or 4 products on around your sink because you want that moisturizer at night. And then you realize that you're also wrinkling in your décolleté, your chest area, which will show aging just like in your neck. So those are areas exposed just like your face that you need to treat in the same manner. As we go into losing our hormone with perimenopause, menopause, and beyond, we're no longer making the amount of oils in our skin. So we actually need to put oil back into our skin. And that's with both dietary, with the choices of foods you're eating and the balance of food you're eating, but it's also a topical oil that you put on your face to help rejuvenate and brighten the skin on your face. So it's about the cleanser you choose. It's about the actual serum that will put moisture back in. It's about putting oils back in. It's about moisturizing from several different levels, but it's really from here all the way down to what we expose to sun. And I haven't even talked about what the effects of regular either eczema or psoriasis or food allergies that may cause skin rashes may do to other areas of our body's skin that we many times kind of don't think about because we're so focused here, we forget to focus on the health of our skin elsewhere. So
that's a great lead into the next question, which is skin conditions. So I know you've both mentioned skin conditions. What causes skin conditions? We've talked a little bit, but things like rosacea, skin rashes, you mentioned some others. Dr. Vicky, carry on with what you were saying.
Thank you. And again, rosacea is that increased blood supply per square inch to your face physically. Know that the function of estradiol as a female hormone is to have blood supply per square inch to tissues with estradiol receptors. And it begs the question, which tissues in our body have estradiol receptors? Every tissue, every single one, which is why the different and variable levels of hormone make a difference in our skin health. But rosacea throws an extra wrinkle on there with extra blood vessels physically. So it's like flooding your face with blood supply from underneath. So that blood supply, yes, brings good things like nutrition and oxygen and pulls away, all of our toxins, but too much of a good thing can be like overwatering a plant. Sometimes that doesn't have good results endpoint for your skin. And again, food allergies is many times you're reflecting it on your skin, sometimes with just red rashes, sometimes it's welting. Many times it is, you don't know what it's from, but constant exposure to changing environment in your skin can prematurely age skin. Psoriasis, eczema, those are genetic conditions where your skin is turning over faster and making plaque where it's rapidly turning over that the skin can't slough what is there. And how do we deal with if there may be that condition going on, that it's not just the unsightliness of it, but it actually is very irritating and itching and very uncomfortable for people to wear clothing over it. Even moles that are exposed to sunlight, skin cancer, and whether it's from sun exposure, whether it is melanoma, which can be extremely fast growing and quite invasive very quickly and difficult to treat. So there are many conditions, but those are both lifestyle, they are just being aware of, but if it's genetic for you, then those are a little more difficult and may require medical help.
Thank you. Dr. Simone, again, what causes skin conditions? I know you deal with that a lot in your practice as well.
Yes, so as a naturopathic doctor, my job essentially is to figure out and peel back the layers of the onion, to figure out what your individual root cause of your skin conditions are. So depending on the skin condition we're looking at, there's going to be various underlying factors that will contribute to that. So if I'm looking at acne, that has, several factors that could be contributing that are going to be very different from the factors I look at when it comes to rosacea. One thing that connects all of these skin conditions together is that we want to support the digestive and gut health. That plays a huge role. A large majority of our immune system resides within the gut. If the gut is not functioning properly, whether you are constipated, whether you have liver dysfunction, whether all of that will contribute to a sluggish, what's called the lymphatic system. So our body's ability to drain and cope with just the byproducts of our day-to-day detoxification and our metabolic processes in the body. And lymphatic system has a huge role to play in what shows up on the skin. So that's one part of it. Another part would be things like stress, diet, lifestyle. So if you're having a diet that's really high in sugar and processed foods and unhealthy fats, seed oils, all of those will contribute to what is showing up on the skin or speed up this kind of lymphatic or increase this lymphatic congestion, so to speak. So, to break it down, if we're looking at, say, rosacea, we know that we're dealing with a vascular component. We're dealing with an element of, say, histamine, which has a large role to play in the gut. We could be dealing with imbalances in bacteria, such as things like H. pylori or low stomach acid. We know stress plays a massive role, just because of what happens on a physiological level when the body's under stress. We don't make enough stomach acid. We can't fend off bacteria. And it can contribute to more inflammation and trigger these kind of outbreaks of rosacea. If we're looking at something like perioral dermatitis, we know there's a hormonal component, an inflammatory component, an immune component, and so on and so forth. And then the main things I'm looking at are immune system, lymphatic system, hormone imbalances, I'd say, as a whole.
Mm-hmm.
Excellent. And just before we get to the next question, which is going to be, okay, now that you've shared all of this information, what can we do about it? Let's all take a little bit of a stretch. We've been sitting for a bit. Stretch, do a little bit of chair dancing, move like Karen is standing up. If you want, do something that feels good in your body. Oh, I know I need to do this more intentionally every day. It's great. Yes. Wherever we hold stress, do that. Take a sip of water or two throughout.
Yes, good for our skin.
Yes.
Exactly. Good for everything. And we're talking about skin, so it's even better for our skin. All right. So what can we do now? And most of us here who are on this are probably 50s and up, but there might be some other people who watch this later who are not in their 50s yet. But what can we do about it? Dr. Vicky, start us off. What can we do about all of these skin condition things from your perspective?
Well, number one is to get it diagnosed, to understand, to find out. And many times people are shamed for how their skin looks because they are told by society, if you don't have perfect skin, it must be your fault. And so we have to get past shaming anybody who may not have that perfect skin.
Let me
Uh,
interrupt for 1 second. We should
Mhm.
never, whatever. Let's not shame ourselves for anything. Let's
Yes,
eliminate shame and
yes.
let's just go for growth. Sorry, I interrupted you. Carry
Yes,
on.
no, that's a great disclaimer statement. It's just with the way society and our youth see on social media, everything is about the appearance. And so that can lead to metabolic issues down the road, like eating disorders and things about body image because of how their skin may or may not look. So I just want to put that disclaimer out there as well. But, what are some things that, that we can do? Well, we have to realize we have to cleanse. We are exposed to things all the time that we have to, get down to the actual skin surface. We have to replace serum hydration, and that hydration may or may not have that hyaluronic acid that Dr. Simone was talking about. We need to actually do some replacement of oils. Some people, especially as they get more mature, oil replacement to your skin is very important. For others in their younger years, it's actually toning down some of that oil. So it may be using some sort of a glycolic in a covering or the next layer of what you actually use with your skin. A skin protection from the sun, whether you use that in a sunscreen that you use, or you're actually using a sunblock if you're going out on a vacation in direct sunlight on a more intense basis. Those have to be, free of some of the really bad chemicals, but you have to understand, even on a cloudy day, you are exposed to UVA, UVB rays. And so that can be very damaging to skin. And we have to protect our skin so that we don't see premature signs of damage to our skin from that. So, and again, what I say for here also applies to other areas of your skin that you expose. And one little medical caveat I'll just throw out, that skin cancer, which can just happen over time, fair-skinned versus more olive-skinned populations and backgrounds and ethnicities. But the one thing I will say is skin cancer is something that will affect more fair-skinned populations and ethnicities first. But anyone who has a pigmented mole, if it is not properly watched, regardless of ethnicity, can be stimulated by UVA, UVB, and can actually lead to melanoma. The most common site on the body is your legs, primarily your calf, because we rarely sunscreen our legs.
Interesting. Thank you so much. Dr. Simone, what can we do about this from a naturopathic perspective? How do we
Absolutely.
treat our skin?
Yes. So essentially, how do we get successful aging? So coming back to that term inflammaging, the definition of that is essentially low-grade inflammation at the level of the skin. So if we can slow this down, we're going to be less susceptible to things like the sun and our environmental exposures, speeding up aging. So are certain diet and lifestyle factors that would be number one. We cannot out supplement or out topical our diet and lifestyle, because our diet and lifestyle will contribute to more oxidative stress, and essentially what comes of that is something called free radicals that break down collagen faster and lead to more premature aging by creating more pigmentation whenever we're exposed to UVB. So number one would be having a diet really rich in antioxidants, fruits and veggies, brightly colored fruits and veggies, lots of leafy greens and vitamin C. And I know that sounds like a very benign and boring suggestion, but truly, aside from taking antioxidants as in a supplement form, I always find if we can get antioxidants from food, that is the absolute best way. So dark purple fruits and veggies, for example, grapes, purple cabbage, those are going to produce a higher antioxidant load. The higher antioxidant load in our body, the more we have to work with when we're dealing with these consistent kind of oxidative damage and free radicals in our body. So berries is another one. Even dark chocolate that contains a high amount of antioxidants. Don't go crazy with dark chocolate, but these are things, any part of the diet that's high in antioxidants is going to be supportive of the skin in the long run. Hydration is another one. So again, hydration, and eating a balanced diet, and also getting moving. There's nothing better that will support our skin's healthy aging. Getting moving will increase the circulation to the skin. Anytime we have increased circulation, it means that all of those nutrients that you're getting from your antioxidant rich diet can actually get to the level of the skin. And also our lymphatic system can help to flush away toxins from the skin. So those are kind of my top three. And then in terms of preventative, prevention wise, absolutely protecting the skin from UVA and UVB rays. I would say that is the number one thing that will lead to premature aging, aside from the kind of diet lifestyle factors. I use rain or shine. I use a sunblock. I don't know if we're going to go into the kind of sunblock
Yes,
in
I'm
more
going to-
detail, so we can chat about it then.
We're going to do that next. So carry
Okay,
on.
so yeah, sunblock is the number one way to prevent premature aging of the skin, but absolutely, the internal piece. And then there are a few select supplements and topicals that I really like to use to support successful aging. Retinoids, which is an active form of vitamin A, I think is very helpful for increasing cell turnover when that starts to slow down. And then I agree with Vicky, anytime that would be more of a mild chemical form of exfoliation, because exfoliation is needed to promote fresh skin cell turnover. But whenever we are exfoliating, we always want to replenish, especially kind of into the years in the 50s, 60s, 70s. We never want to strip more than we're replacing, because we don't have as many what are called essential fatty acids to support our skin barrier. So I agree that supplementation wise and topical wise, we want to be replenishing that skin barrier with ceramides, healthy essential fatty acids in and out. So yeah, I could go on,
Okay.
but I'll stop
Yes.
there.
We have some fantastic questions in the chat that are coming up
Okay.
around this. Okay, but I'm going to just go to one in particular, because sunscreen is controversial these days. Sunscreen and sunblock, what's the difference?
Mhm.
And we still need vitamin D activation from the sun.
Absolutely.
You will both know more about that than I do.
Yeah.
But if we're using sunscreen, which I hear you both saying we absolutely need to do that daily, no matter
Mhm.
where we live in the world, how about vitamin D production? And what is too far? What are some toxic ingredients? What sunscreen products? I don't care if you mention brand names here. There are no sponsors that are going to get their knickers in a knot. So
Sure.
tell us, what should we be doing from your perspectives?
Sure. Do you want Vicky?
Go ahead, Dr. Simone. Go
Yeah,
ahead.
Dr. Simone, carry on.
Okay. So absolutely, when it comes to vitamin D, I have seen some of the lowest vitamin D levels in the last few years, especially since COVID has become a part of our lives. I have seen some vitamin D levels as low as in the 20s, when our optimal levels are supposed to be up at 120. So I absolutely agree that when we do see the sun in Vancouver, we're meant to be exposed to sunlight. We're not meant to hide indoors all the time. What I will say about it is, depending on your particular skin type. So lighter skin types, there's a scale called the Fitzpatrick scale. It's on a scale from 1 to 6. Types 1 to 3 are fairer skin types and more easily to burn. Those kinds of people actually absorb the sunlight more easily, are more prone to things like burns, but also convert vitamin D into its active form a lot more easily than darker skin tones. So ironically, darker skin tones sometimes can end up being more vitamin D deficient. And vitamin D is exceptionally important for the skin health, which is the irony of this. It actually helps to modulate the immune system at the level of the skin. So we do need vitamin D and we do need sunlight in moderation. So I always suggest people get 10 to 15 minutes a day on their arms and legs, and that is it. But when it comes to kind of being out in the sun for prolonged periods of time, and especially when it comes to successful aging of kind of the face, neck, and hands, I do suggest a sunblock daily. And I say sunblock very intentionally because I am a big proponent of using mineral sunscreens like zinc oxide as opposed to the chemical sunscreens. Chemical sunscreens, the difference between the two, chemical sunscreens actually absorb the sun's rays, so UVA and UVB, so that your own skin itself is not absorbing the rays, but it is a chemical reaction that happens. And a lot of those chemicals are known to disrupt your hormonal balance. So they're called endocrine disruptors, and they mimic hormones in the body, which can basically throw our hormones for a loop. So I always suggest zinc oxide. Zinc is a very important nutrient for the skin in general, even if it's taken internally. But in the case of sunblock, we're actually just blocking those rays. And that's kind of what I'd suggest any zinc oxide based sunscreen. So I have a
Okay.
couple I like.
So
But
before Dr. Vicky has her response, so Dr. Simone, while Dr. Vicky's talking, if you have some
Mhm.
recommendations of brands we should look for in Canada, and maybe
Yeah.
Dr. Vicky could do that from the States, put those in the chat, please. That would be great.
Sure.
So Dr.
Mhm.
Vicky, what are your thoughts on vitamin D, sunscreen, sunblock, etc.?
Well, and again, I echo what Dr. Simone said. Some of the lower vitamin D levels I've seen have been below 10. And these are people who might be outdoor laborers. And you wonder how that can be that they're not able to absorb from through their skin. Why are they so low? And sometimes it is a genetic factor. There are times that people, one patient in particular I'm thinking of is a surfer, and in his 60s in California, he was surfing every day, but you wear your wetsuit, or at least your short wetsuit, but legs are exposed, face is exposed, hands are exposed, and yet his vitamin D level was 15. So, there are unusual circumstances where even with direct exposure to sun, you may have to supplement with a vitamin D supplementation or have enough oils in your fish in your diet or other sources of good lipids in your diet to be able to do that. And if you have to take a supplement, please take that supplement and get your vitamin D levels checked. It's actually a hormonal secondary balancer to the four main hormone groups as the foundation of your health. But in regards to zinc oxide versus titanium oxide, those are what are considered mineral sunblocks. The zinc oxide is much healthier for your skin. And my favorite is actually a brand called SkinCeuticals. I don't know if you can see that, but SkinCeuticals is a brand that is very cosmetic related, carried on Amazon, so it can easily be ordered. Most people think, oh, I can't put zinc oxide on. I don't want the white nose. Well, you can rub it in quite well so that people don't even know that you are actually wearing that sunscreen. In regard to people that want a pigmented addition to their skin care every day, you can actually use a tinted sunscreen. It's all about, and you'll see it on the outside packaging, what is the SPF, which is your level of skin protection from UVA, UVB, primarily UVB. And this just happens to be the one that I use, and it is by a company called Monat, which stands for Modern Nature. And it's a pigmented sunscreen that has an SPF of 40. This is an SPF of 50. And so there's controversy. What is the strength of SPF? That is still, is there overkill? Can you go too high and it's not effective? That's controversial. But on the chemical side of things, the one chemical you have to really be careful of is anything with oxybenzone in it. That is going to be the worst for your skin. And think of anything chemical you apply to a large surface area, your body is absorbing that chemical versus a mineral is something more natural to your body. So if there is any basic, what's the difference between the two? Mineral is going to be better for you than chemical.
Thank you. And That's a great question here. Two things before we move on. Can you overdo vitamin D?
You can, but it's quite difficult, and I would measure vitamin D levels. Um, People would always hear the story, and this may ring true as I say it, that if you're a hunter and you hunt bears and you're eating the bear liver, like how much liver should you eat? Well, if you eat a large concentration, like in a bear's liver, there were campers and hunters that were found dead at their campsite because they ate too much bear liver. So you can ingest too much vitamin D at one setting and have it be toxic, but it's extremely unusual. And on a daily basis, I would check your vitamin D level once or twice a year just so you know. And there are optimal levels. There's a range, the reference range, but you don't want to be at the lower end of the reference range. Optimal, even for prevention of Alzheimer's, is a level between 60 and 80.
Thank you. Dr. Simone.
And this is where I find it interesting kind of from the naturopathic versus conventional standpoint, because if I see a vitamin D level of 80, then I am certainly increasing supplementation to get them up kind of closer to 120, for example. So we see this a lot of times just in comparison, conventional ranges, naturopathic ranges. One is not the right answer, but I would have kind of an interesting or slightly different take on it, that I think you can over supplement, because I've seen especially a lot of people, I think it's a lot to do with kind of who's coming in to see me in the naturopathic world. More is not always better. And we know that when we're supplementing, some people they're thinking, well, it's a supplement, it can't do any harm, but really we can actually do quite a bit of damage if we're taking supplements in the wrong quantities or the wrong supplement for our body. So, and as Vicky mentioned with the bear liver, the reason some of these nutrients can become an issue is because they're fat soluble, which means once our levels are up, they stay up quite well. They can build up in the body because we've got a lot of fatty tissue in our body. So vitamin D is no exception. Absolutely, we can go overboard with it. So if you've been taking vitamin D at a high amount, more than the recommended dose for years on end, then it's possible that your levels are too high. What that means, there can be side effects associated with it, but really what I'm worried about in certain populations is how much calcium they're absorbing, because vitamin D helps us absorb calcium from our diet and from other sources. So, contributing if you're more prone to things like kidney stones, or, I have in a rare occasion seen vitamin D levels way up above 200, where I'm like, okay, don't supplement with vitamin D now for a while, because we don't want to keep increasing those levels. So it takes a while for it to actually become a major problem in the body. But, in terms of calcification, we don't want calcification in our blood vessels. We don't want excess calcium building up in our kidneys. So I do, same as Vicky, encourage people to get their levels tested, because on the opposite side of the spectrum, if your vitamin D is low, you're never going to get up to where you need to be with just the basic 1 to 2 drops a day. We do have to increase that for a short period of time to get you where you need to be.
So much great stuff here. We're going to take a short pause because we have reached the top of the hour, and I'm going to share my screen, and then we will have our Q&A. And we have so many questions in the Q&A. I'm not sure if we're going to have time to get to them all. So let me just do this, and we can carry on afterwards with that. I will be right there. And you let me know when you can see that. Okay, perfect. Myself, if you're here, you probably know this. We are all about offering you more choice in your health decisions and helping you become your own best health advocate. And our next event is not until September, and we're going to talk about breast health. We have not done that yet, and I think that is another really important conversation. So we're calling it Vibrant Vitality for Breast Health. And we'll be exploring again hormones, because hormones seem to factor in every single thing that we do and every single thing that we are, signs and symptoms to pay attention to, risk factors, etc. And that is going to be Friday, September 20th. And the invitation, if you sign up today and reserve your spot, I could be charging $50 or more for these, but I'm not, because I want people to come to these. And if you enter your name today, or you already signed up in advance, because we had that up before, your name will be entered into a draw for a vacuum insulated thermos, which is really great. Karen, you have one of those, and a collapsible zipper cooler bag, and it's really easy to mail. Hold on one sec, I'm going to grab them. Here we go. So the thermos will come in this box, this handy dandy container, and this one happens to be white. It's really, really a lovely, it keeps things cold or hot for 24 hours. And then this is the zippered cooler bag. So it folds up and it expands, and it's great for your trunk if you're carrying stuff from grocery store and you have to keep it cold. So those are the two products, and they are from our fabulous sponsors, and they'll be shipped to you anywhere directly in the Canada or the continental US. And the other bonus, a coaching session. I know, Daylan, you had one from last time with Bill, and that really is an amazing thing. Bill has been coaching for decades and has a wealth of wisdom to share with you. And here we go. So our sponsors, Bill at BFO and the gift basket company, Spread to Love and Brand and Ink. Thank you so much to them for providing these gifts. And ways to stay connected with Mind Myself. And Wendy, if you could put in the chat as well, how to stay connected with me, that would be great. But Mind Myself, we are taking things to the next level this year. And so thank you for joining us here. If you would like to donate, happy to accept your donations gratefully. If you wish to donate to Blind Beginnings, they are a local charity that helps children and families who are blind or sight reduced. And there's also Vays of Transformation, which is an African charity in I think it's Uganda, and they help young women have access to period products. We take it for granted here. We can go to a store and buy tampons or pads, and they cannot. And some of them are using old rubber tires or rags or newspapers. And wouldn't it be great to be able to help some of those women have what they need? So you can stay connected. We have a survey, Myndful Health survey. We'd love to hear your thoughts so that we can respond. I'm thinking of adding diabetes conversation in the new year as well, because that's something that's very important. Visit the website, sign up for our monthly Mindful Moment newsletter if you haven't yet. We send them out once a month, and they're full of great information. And of course, you're welcome to join the community or follow us on our socials. And that is it for today for that. And back to our regularly scheduled programming. We have so many questions to talk about from the chat. Let me start with, unless Dr. Vicky and Dr. Simone, if there's anything else from what we've talked about already, if you say, oh, I must get this in before we continue to the Q&A. Do either one of you have that, or are you ready to proceed?
Well, I just wanted to say, there's a phrase we've all heard from little on up called garbage in, garbage out. And so that just brings home the message that, this whole podcast has emphasized so much, which is we are what we eat. Another phrase we've all heard from little on, that what you put into your body will reflect on the outside. And so you need to understand that sugar is one of the worst things you can do. It causes inflammation, and balance is usually one of the best things that you can do. So hydrate, balance, get rid of the inflammation, the skin inflammation, support your collagen. But again, just remember those simple phrases we heard from moms and grandmas endlessly. Garbage in, garbage out.
Thank you. Dr. Simone, how about yourself?
Nothing really. I noticed that my old bio from my other clinic was at the beginning of our chat, so I'll update that to make sure it's the correct one and correct.
Okay, fantastic. Thank you. Always like to have the correct information, so please put that in the chat for sure.
Sure.
All right, I'm going to start at the top, and we may jump in and out. So this is great. And I see some people signing up already for September. Thank you. What can we do about liver or age spots on our hands? This is from Dale Ann. Dr. Simone, let's start with you.
So, I mean, I definitely have a lot of experience working in clinics where we do a lot of the cosmetic treatments. So, I would say to truly get rid of things like liver spots on the hand, there's certain lasers that can help a great deal. Something called intense pulse light, IPL or Lumeka. Those are kind of if you're looking to actually do a treatment to get rid of them. If we're looking to prevent them, then absolutely the hands get forgotten about when it comes to skin or when it comes to skincare. We kind of forget to put sunscreen on our hands, but there's actually a lot more hand creams that have SPF in them. And I think that that should be something that's so commonplace because even if your skin health it looks great, your neck, décolleté, and hands will show your age essentially. So the other thing, I mean, in theory, that could help speed up skin cell turnover would be kind of very mild exfoliants, but it can be a little more irritating on the hand to use things like retinoids. So typically I'm recommending more of a laser type of a treatment to get rid of those.
Thank you. Dr. Vicky, sun age
That
spots.
Yes, that as well as there are some skin bleaching agents that are very mild that you can use. Think of the concept of a skin peel at a cosmetic institution where they will actually do an increased level of different types of glycolic acid, different levels, different concentrations of, but you can do a very mild one every day that you can actually apply to areas of melasma on face, but we call them liver spots or age spots on your hands that you can actually decrease or bleach out. You're not going to eliminate, but you're going to bleach out. Think of an iceberg in water, you see the tip of, but what's underneath may actually be bigger. So sometimes even as you have skin turnover and you're bringing up a liver spot, so to speak, it may actually fade but get broader as the base comes up, and then you will actually take away that quote unquote increased pigmentation. So
Thank you.
it's understanding why it's there. It's understanding that your melanocytes just may be more concentrated in one area on your hand, but it's also understanding what is the process you're doing and that you've got to get the surface, the middle, and the base. And that just will happen as skin turnover happens over time.
Fantastic. And thank you, Dr. Simone, for putting your updated bio in there. We'll make sure we have that on our site. And there's also some energy technology out there that can help with skin and age spots and other things. And if you want to know more about that, both Dr. Vicky and I are representatives for LifeWave, and that can make a huge difference. I know that I personally am experiencing massive shifts, and so is Bill, on our skin and a number of other people here. So if you want to know more, definitely reach out. Tanya says, as I'm getting older, I've noticed bags under my eyes are getting worse. I would love to know what causes those. And besides getting a good sleep, and of course, as you said, garbage in, garbage out, eating a proper diet, is there anything else that you would recommend for bags under the eyes? Dr. Vicky.
Well, one of the things I personally experienced was when you have lack of collagen in your cheekbone area, and I had a differential lack or compression or change in collagen because I sleep on this side. And so constant pressure all night, sleeping on one side of my face. Actually, I woke up one morning and I had a bag under only one eye, which looks really unsightly, like you just got punched in the face or you had a reaction to something, or it was just very obvious. It hit you as the asymmetry. And what I did was put a good quality collagen with antioxidant, anti-inflammatory into my body morning, night for 4 days. And what it did is it beefed up the collagen right where I needed it. And the bag was gone. And so think of proper collagen support as if you do it with the right collagen, you can actually give yourself a mini facelift. you get rid of bags under your eyes, because realize this tissue underneath is very, very sensitive, especially the part where you come off the bone and it's now just soft tissue. The lymphatic drainage from around your eye is literally this way, and underneath your eye, it's towards the bridge of your nose. So when people rub their eyes, you're disturbing that lymphatic flow drainage. But if you want to help improve drainage, you need to push gently toward the bridge of your nose
Got it.
and massage it that way. And so, but it's the collagen here. If you lose collagen here, you pull those very thin lymphatics closed. They're very, very thin walled. So you put enough pressure on it, you will pull it closed. The fluid will back up, and there's your bag under your eye. Replace the support to the under eye complex, and you will get rid of your bag, and you can do that with the right collagen.
Interesting. So let's, maybe in the chat, you could put what the right collagen is. If you feel like doing that, that would be great. And we've had two other comments in the chat. Can I get rid of the bags also with vitamin E rubbed on daily?
I
And
think
or
that was about the liver spots. She had
castor oil. Okay.
responded
Mm.
after the liver spots with the
Great.
vitamin E.
Yeah, so Dr. Simone, over to you for any of those, about the liver spots and or the vitamin E or castor oil for skin health.
Vitamin E will not get rid of liver spots if rubbed on daily. Vitamin E is a great antioxidant, very important for the skin. I recommend it usually in a combination with vitamin A and C. That's one of the first supplements that I do recommend just for general skin health, something with vitamin A, C, and E. And zinc, but when it's rubbed on the skin, it can be helpful in some cases to soften scars I've heard of, but I've never seen it clear liver spots, unfortunately, or darkened sunspots on the hands. It can be very moisturizing though, which can increase kind of the quality, the aesthetic look of your skin on your hands whenever it's more moisturized. In terms of castor oil for skin, I use castor oil a lot for things like styes. Basically castor oil helps to draw out things. So we can actually apply it topically over the liver to stimulate blood flow to the liver. I use it in various kind of gynecological conditions over the ovaries, which is not skin related. Castor oil is very thick, so I don't recommend, even with the driest skin, it can create more of an occlusive barrier as opposed to penetrating the skin. So I reserve it, unless it's a very specific reason, I reserve it for helping with hair growth, like eyebrows, eyelashes, just along the lash line, or for things like styes.
Okay. And collagen supplementing. So Dr. Vicky put that there, belgraceglobal.com. Bella Grace has another one, and of course you can get that through Dr. Vicky. Yeah, there are different ways to approach that. So somebody has coming back in here. We've talked about sunscreen. How does liver health impact skin health? Dr. Simone, you just talked about.
Got a little feedback here.
Yeah, we'll just mute somebody. There we go. Dr. Simone?
Yeah, so liver is essentially how our body, it's one of our main detoxification organs. We have several, the skin is one of them, but we need a healthy functioning liver. So just because you don't actually have elevated liver enzymes in your yearly blood work doesn't mean that your liver and gallbladder are functioning as optimally as they could. And as we age, I find liver function can get a little more sluggish. It requires a lot of nutrients to be able to detoxify. The detoxification process is highly complex and requires a lot of vitamins and nutrients and what we call cofactors to help us detoxify every single thing that we put on our skin, that we eat, that we breathe. So liver health, I mean, it is pivotal to skin health, especially in certain conditions. It's not always the very first place that I go in terms of every skin condition gets, a liver cleanse. But we do want to make sure that in general we've got a healthy liver, because if we do not, then we are going to experience a buildup of toxins in the body. We're going to have a lot more of that lymphatic congestion I was talking about earlier. And even in relation to things like those skin bags, or sorry, skin bags, under eye bags.
Skin
We were
bag.
under eye bags we were talking about. A lot of times under eye bags, I mean, under dark circles and under eye bags are one of the toughest things to treat. But a lot of times bags have to do with our lymphatic system and our ability to detoxify, in addition to hormones and other components and genetics. But one of the first places we can start is by supporting liver and lymphatic system. And there's a lot of herbs and supplements that can help to do that, because oftentimes the bags we're seeing are repeated water retention or lymphatic congestion in the face.
Fabulous. And before we get to Dr. Vicky, I want to read the response that Dr. Scheherazade shared in the chat. She said, the liver produces bile, which aids in the digestion and absorption of fats, including fat-soluble vitamins A, D, E, and K. And these vitamins are crucial for maintaining healthy skin. And as I've heard you both saying, the best sources of those are, of course, from our food, but we have to be really intentional about that. So Dr. Vicky, you are now muted. You could unmute yourself, and somehow that just happened. If you could unmute yourself and talk about the liver. Thank you. You're good now.
Yeah. Well, and again, everything Dr. Simone said, that our liver is the biggest detox organ in our body, and that's cleansing our bloodstream. And so realize that we also have toxins in our tissues that need to be cleansed. And many times it's those toxins in our tissues that can release themselves at different times that our liver may be overwhelmed. It may be given too high of a dose. So realize that the liver can regenerate itself as well. So it can undergo damage and it can be cleansed. And if even part of it has to be removed for cancer or some other reason, it will regenerate itself. It's one of those organs that it's essential to bodily function and longevity. So if we don't have a liver, we really never cleanse our blood and we're in big trouble. So, our maker knew this when we were formed, and therefore liver is just one of those essential organs. And I totally agree with Dr. Simone. Your levels may not reflect where the health of your liver really is. And detoxing it is something I would regularly recommend to people. Usually it would depend upon the level of what they needed, but I would regularly tell people that one of the things they could do daily, even if they were not up for a regular detox, would be organic apple juice every day. Just do 2 to 4 ounces of organic apple juice every day. The old adage, an apple a day keeps the doctor away. It really, I think, is part of that tannin and tannic acid from apple that helps to keep things from sticking, if you will, to your GI walls. And that can cause inflammation. Inflammation can get into the walls of a GI tract. All of those can decrease GI absorption. We all know there's a gut-brain connection. There are so many ways that our gut and our liver are intertwined, but our liver is the great cleanser, and again, of our bloodstream. So no, there are toxins in tissue that is more of a methylation process, and that's a different subject, but know that blood cleansing happens primarily in our liver.
Thank you. And we've talked about collagen, and there are comments here. The best collagen really truly can come from bone broth. So yes, we can supplement, but probably most of you who are eating meat of any sort can make a bone broth in a slow cooker or on a pot on your stove. And if you drink some of that every day, you're going to be getting a really good source of collagen as well. Do both of you agree or disagree? Dr. Vicky?
Oh, absolutely. And I do it with beef bones. I do it with chicken bones. And with chicken bones, I actually throw the skin in as well, because now I'm pulling out those oils from the skin. And I am then therefore discarding the skin, and you end up discarding the bones. But that is my favorite chicken broth. I make that constantly, and that's always a supply that's in my freezer. So
Dr. Simone?
Yeah, so collagen, I'd say the main thing if you're making it at home is to ensure that you have really good quality meat and that it's grass-fed organic. Because if you think about it, if you put just regular bones from the grocery store into a pot, and you've got a certain level of fat still on the bone or other things that are going to contain a lot of toxins, and ultimately that's going into your system. So that would be the one caveat I'd say. But otherwise, I think kind of our body assimilates natural forms of nutrients like collagen better than it does supplements a lot of the time. And then the only other thing I'll say about supplementing with collagen in general is that how it works is you ingest the collagen and it gets broken down into it's peptides that make up collagen, and those peptides go wherever they're most needed. So you may be taking it for skin health, for example, but your body decides, well, your knee needs it more. So it's going to go wherever it's needed first. And it's not like you take the collagen and the collagen just goes straight there. It's actually that you break down the peptides, you absorb them, and then you've got excess peptides to be able to basically make more collagen where it's needed in the body. So that's just something to take note of. So usually when I'm doing or suggesting collagen specifically for skin health, I suggest type 1 and 3. Whereas if you're looking for full body health, I suggest kind of a broad spectrum collagen.
right. And just to add to that, if you're doing a collagen powder, the big blue tub, for instance, that you might find at a big box store or a warehouse type store, those are research proven to be less than 5% absorbed by your GI tract, because the length of the peptide in that collagen is 30 to 40 peptides long. And so it may be a great bargain. You feel really good about taking it, but you're absorbing less than 5% of that collagen. So realize, again, garbage in, garbage out. You're looking for a good collagen that's 3 to 4 peptides long, and those are going to be more highly absorbed. And the one that I'm recommending is 3 to 4 peptides. It's actually a something that is considered very highly unusual availability, and you're absorbing more than 95% of that collagen. So it's all about, it may sound good, I'm taking collagen, but what are you really getting into your system, and how is your body really working with it?
Excellent. I know both of you have talked about food and eating lots of vegetables. So specifically, Karen says, how soon do vegetables in diet take effect? I've been on an increased vegetable diet for about 5 years. Does that have an effect on fewer vegetables before that? So yes, how long will it take for if we haven't been, if we've been putting garbage in, let's just say, and then we start putting the good stuff in, more of the good stuff, even if we don't take out some of the bad stuff, if we put more of the good stuff in, how long does it take to take effect? Dr. Simone, why don't you start us off on that?
Yeah, so I mean, I'd say it's never too late to start incorporating more
Yes.
veggies and bright, colorful foods into your diet, and it also leaves less space. So anytime we're putting more veggies in, we don't have as much appetite, or we're saving less room for the bad stuff. So it won't necessarily undo a history of poor eating or not having enough antioxidants in the diet. In my mind, it has to be considered kind of a lifestyle, as opposed to just, okay, how long until this works? We are constantly being exposed to toxins. So we need basically everything we can get. And the other issue is just our food system itself. Our foods are not as rich in minerals and nutrients and antioxidants as they used to be, just because our food is so mass produced. It's picked a lot of the time before it's ripe. It's stored in certain temperatures. So in my mind, the more the better. And also, the more we can grow in our own gardens. I know a lot of us don't have time to do that, but that is going to be the best way to ensure that your fruits and veggies are actually organic and actually nutritious.
And
Mhm.
George, just before Dr. Vicky, you can come on with your comments. Connect with local farmers.
Yeah.
There are local farmers and producers everywhere, and that really is the source of our food mostly anyway. So connect directly, cut out the middleman as much as possible.
Mhm.
Not that I'm anti the middleman, but go directly to farmers. It's the best food around, and it's probably going to be the same price or better than what you would get in a regular store. And the taste right off the bat. We've started doing that this last couple of years. And oh my gosh, I can feel the difference in my body and it tastes different. Dr. Vicky, vegetables, etc.
Vegetables, that is my middle daughter's mantra. Vegetables, vegetables, mom, vegetables, more vegetables. And as a PhD in nutritional science, that was her legacy. That was what you do. You grow your own, you have a home garden, or you go to the farmer's market. She taught nutrition to children of migrants that they're working 2 and 3 jobs. How do you teach proper nutrition? You teach it to the children. So the parents learn from the children. And if you can, in all, vary your diet, please vary your diet, but vegetables and your fruits and vegetables as colorful as possible. People don't realize carrots come in 5 to 6 different colors. And, just hearing that alone, it's like inspiring to run to the grocery store, or to the farmer's market, I should say. But many of those grocery stores, at least in our area, do work with local farmers, and they do bring in local produce, and it's just such a wonderful thing to see. But I have visions of her wedding bouquet was an artichoke surrounded by kale and broccolini. That was her wedding bouquet as a PhD in nutritional sciences, and it's still just this wonderful memory of, oh my gosh, and thank goodness I have it on my phone, because it's just the perfect picture of what she represented. And what we all should think about is, how do we substitute what we normally do in our day with the healthiest things we can do? And that's vegetables.
Thank you. We are coming to the end of our 90 minutes, but if we have a few more questions, if you're willing to stay on, doctors, that would be amazing.
I have to go.
You have to go?
I'm so sorry, but I have another obligation that I'm
Okay.
committed to. So thank you
we'll-
so much for
We'll
this
wrap this,
opportunity.
we'll wrap this up. If you can stay 2 more minutes, then I just wanted to see if you could. But so I think a last question, does excessive fat in the body contribute to skin issues, especially with a concentration of belly fat? Let's give really short answers. Dr. Simone?
So again, it kind of leads back to it. If there is more belly fat, I'm wondering, is there a hormonal imbalance? Is there an excess of cortisol in the body? Are we dealing with excess adipose tissue because our blood sugar is dysregulated, and our fat stores a lot of toxins? So our fat is actually there to protect us in a way. It kind of absorbs anything toxic that our body isn't good at flushing out. And the more fat we're carrying, the more inflammation potentially that we can have dysregulated in our body. So it absolutely can play a role in that inflammaging or increased inflammation at the level of the skin, ultimately kind of down the pipeline.
Thank you. Dr. Vicky, do you have any comments on that?
Yes, every menopausal woman gains belly fat, 5 to 7 pounds, and it's hormonal imbalance. We become more male than female because our female hormone production drops off with ovaries stopping making it, even though our ovaries continue to make testosterone. So with that increased belly fat and increased testosterone, we may have increase in things we don't want on our skin, like excess facial hair, loss of hair, acne, and that just can compound the whole hormone imbalance even more. So, but the other part of that belly fat is that belly fat may actually change our abdominal to weight, or abdominal, ratio, that it could put extra stress on our heart. And yes, cortisol absolutely is one of those foundational hormones. Thyroid's foundational hormone. Our insulin is a foundational hormone, and our female male hormones.
Thank you. So I'm going to end, I'm going to wrap up with a quote. Your skin is the fingerprint of what is going on inside your body. We've been hearing about that all morning now. And all skin conditions, from psoriasis to acne to aging, are the manifestations of your body's internal needs, including its nutritional needs. And that's by Georgiana Donadio, an American physician and author. And I want to thank you so much for being here. And we are dedicating this to Stephanie, Vicky's daughter, who passed this week. Thank you for being here, Vicky. And thank you all for being
Thank you
here.
for the tribute. Thank you.
Yes.
And just keep in your head that image of a or an artichoke and broccolini for your potential for what would you want to put as a centerpiece on your table? Think artichoke, think kale, think broccolini. Think of that as the perfect, that was her wedding bouquet.
Thank you. And so thank you all for being here, and for Dr. Vicky for adding your thoughts and your heart to this. And Dr. Simone, thank you also for being here. And for all of you, we do this because you matter. Thank you.
Thank you for having us.
Thank you.
And we're doing this because you matter.